Good morning. This is Dr. McDaniel. It's bright and early on a Saturday morning, and I'm a board-certified obstetrician gynecologist in New York City. And I'm bringing to you all things health-related for women. Yes, guess where we are? We are at the horse farm, Baymar Horse Farm again. It's Saturday morning. It's a gorgeous day, but unfortunately, it was a little bit chilly, pretty chilly this morning. We actually had ice on the window and on the car window, and it's a little bit too chilly. Everything's wet from the dew, so I'm going to stay in the car for today's session. Should actually be a fairly quick session. I just thought I would speak on an issue that's come up about twice this last week in the office, or this last 2 weeks in the office, and that is women with a history of neurologic issues such as strokes or TIAs, which are transient ischemic attacks, or migraines with an aura, and they're taking regular combined oral contraceptives or birth control pills with both estrogen and progesterone in them, because I had a young patient who has migraines with aura who came in new, and she was on a regular birth control pill about 2 weeks ago, and had another fairly young patient in her late 20s who'd actually had a stroke, and she also was on birth control pills with estrogen as a new patient. And I had to tell I asked both of them if the previous doctor knew that they'd had a stroke. Now, there are different types of strokes. There are hemorrhagic versus occlusive strokes. And she'd had an occlusive stroke, or a thromboembolic stroke, which means that her blood coagulated or clotted up into a ball, and that ball flew through the blood supply and blocked off one of the arteries in her brain, or small capillaries most likely in her brain, and she had a stroke. So it wasn't a hemorrhagic stroke where the blood vessels just burst. It was an occlusive or a thromboembolic stroke where it got clogged up. So the issue with birth control pills, which has always been the issue, and why there's still that small warning on the, in the fine print of the birth control pills that says that they may cause strokes, heart attacks, pulmonary emboli, thromboembolic disease, deep vein thrombosis, because it still holds true. So no one knows what any given individual's threshold is for getting a blood clot from being on any kind of chemical agent that increases the risk of blood clots, and that includes birth control pills. So birth control pills all contain estrogen, and estrogen is well known to increase the risk of the blood clotting or coagulopathy. So the catch is that all of the birth control pills have varying degrees of estrogen. Only one type of pill does not have estrogen, and that's called a progesterone-only pill, because it only has progesterone. All of the other pills are combined oral contraceptives, so the combined refers to the fact that they have both estrogen and progesterone as the components of the hormone. So birth control pills feed your body the hormones that they already have, either progesterone alone or estrogen and progesterone, so that it prevents your body from ovulating. The catch is that over the years, the amount of hormones has decreased, and because we've been able to decrease the strength or the amount of the hormones in the pills from over 200 mics all the way down to either 10 or 0, the risk of strokes, heart attacks, deep vein thrombosis, thromboembolic disease has accordingly decreased. The catch is it's only decreased, it's not 0. So that being said, when someone is known to have a thromboembolic event, such as they got a blood clot in their leg, that's a deep vein thrombosis, or they got a blood clot in their heart, they've had a heart attack, a blood clot in their lungs, they've had a pulmonary embolism, which has a 50% mortality rate all by itself, or they've had transient ischemic attacks, or they've had teeny weensy little strokes that have come and gone, or they've had a full-on stroke, or lastly, if someone's had migraines with an aura. The aura refers to the fact that they have basically a premonition that they're going to have the migraine pain, and the premonition is because they have visual disturbance, blind spots, black spots, blurred vision, or they literally go blind for a few seconds or a few minutes before they get the migraine pain. That aura indicates that the blood vessel to the eye, the ophthalmic artery, is spasming. It's closing, opening, closing, open. So obviously when it closes, decreases the blood supply. You decrease the blood supply, it's not going to function well, which is why there's the visual disturbance. Well, when it spasms, that spasming or contraction of the artery also just by itself increases the risk of a clot forming in that area because of the turbulence that's caused with the blood flow. Now you add on to that estrogen, which also by itself increases the risk of strokes and clots and coagulation. You're going to increase whatever the baseline rate of having a blood clot build up in that artery and potentially cause permanent damage to the eye or blindness to one or both eyes. So, because of the coagulation risk, anyone with a known history of having a clot in their bloodstream is recommended not to go on any form of birth control that contains estrogen. Now, progesterone does not cause clotting, so that's why the progesterone-only options are viable options for women with a history of coagulation issues such as deep vein thrombosis, pulmonary emboli, strokes, heart attacks, transient ischemic attacks, and migraines with aura. The progesterone-only pill, the catch with the traditional or the classic progesterone-only pill is that it does slightly increase the risk of breakthrough bleeding or non-scheduled bleeding or bleeding outside of what should be the menstrual week. The newest progesterone-only pill, I shouldn't say the absolute newest, but one of the newest is the Slynd pill, SLYND. And that one actually is really good. It's been out, I feel like it's been out for almost 3 years now. It is brand only, but they often have it comes with a coupon pretty much. And a lot of the insurance plans do cooperate with the coupon, so that it ends up being like $25, $30 a month or something. But that one is really good because I have not had any patients complain of breakthrough bleeding on it at all, which is amazing. And, most women will have super light, short menstrual cycles or not get cycles at all. So they don't have to take that pill every day at the same 1 hour time frame. They only have to take it every day, which is a huge advantage. And most women will get 1 to 2 day menstrual cycles on that because it prevents blood from building up in the uterine lining. So nothing builds up, nothing comes out. And a lot of women, once they've been on it for a while, they don't get cycles at all. But more importantly, it does not increase the risk of strokes, heart attacks, pulmonary emboli, deep vein thrombosis, all of the unwantedness from estrogen, because there isn't any estrogen in it. So I just wanted to put this presentation up because I've seen a handful of, I saw 2, one just last week and one the week before, and a handful just in the latter part of this year who've come in from other doctors, and the doctors never mentioned to them that there's a risk of problems on a regular estrogen pill. And lastly, The Yasmin, B-Yaz, that collection or that category is a special category of pills where it has very low estrogen, but the progesterone is actually more responsible. The drospirenone, which is the progesterone component, is more responsible for the risk of clotting and coagulation issues. So that pill has a higher risk of strokes, heart attacks, pulmonary emboli, and the ELK than the equivalent other pill with the same amount of estrogen. So it really should be avoided if you've had a history of any of those issues. And there's an increased risk of having those coagulation problems, even if you've never had an issue or a history of strokes, heart attacks, and such on that drospirenone category of birth control pills. So I hope that's been helpful information. A little bit longer presentation than I thought it would be. Hope that's been helpful information on what the deal is, what's the dealio with pills and strokes or migraines. I'll do one last scan from my car because it's starting to warm up since it's nice and sunny, but it's still a little too chilly and a little wet from the dew. I hope everyone has a great rest of their weekend. Here's the panorama. Have a great rest of your weekend. The girls are taking their lessons inside the stable there. It's a huge, like almost football sized stable, so you're not going to see them. And of course, because we're early, private lessons at 8 a.m. from 8 to 9 a.m. there's usually no one else here, no one else crazy enough to get up early enough to get here at 8 a.m. So everyone have a great rest of your day. Bye.